If you take a look at the research and the literature in terms of how and why diabetes causes this early menopause, and then the connection between the diabetes and the early menopause, unfortunately, we don't have a clear-cut explanation or the pathophysiological mechanism to explain how this early onset diabetes is actually triggering this early menopause. But we know for sure that these patients who are diagnosed with the diabetes early on in their life, and the longer they're diabetic, there's something called a premature ovarian failure. I mean, technically, it's a decreased estrogen production by your ovaries, turning it into menopause. And let me take a few minutes to kind of share some of the articles or the research publications to try to see the relationship between the diabetes and the early menopause. I think the first thing that comes to mind is there is a study which was actually discussed or presented at the North American Menopause Society last year, and then was recently published in the journal Menopause just a few months ago, back in January 2023 this year, titled The Association Between Diabetes Type, Age of Onset, and the Age at Natural Menopause. What they have done in this Canadian study was they looked at about more than 11,000 women, and noticed that their average age at the natural menopause was 52 years, which was the average in the society. But their observation was earlier, the patients with the type 1 diabetes are diagnosed before 30 years, or type 2 diabetes diagnosed between 30 and 35. Those patients had a clear association with early menopause as compared to non-diabetics in such huge, a group of study individuals. What they also found was the later the onset of diagnosis of diabetes was correlating with the later onset of menopause. Meaning, the earlier you get the diabetes, and the earlier the menopause, and the later the diabetes diagnosis was found, the later you would get the menopause. And the other good news was there was no correlation. There's no clear significant association between gestational diabetes, which is diabetes, temporary diabetes during your pregnancy, and your early onset menopause. So that was pretty clear, and then wasn't anything surprising. But for the next study can be more applicable to the Asian or Indian audiences. This study was published back in 2015 in Journal of Clinical Diagnostic Research, titled Early Menopause in Type 2 Diabetes, a study from South Indian Tertiary Care Center. What they have done is they have looked at 300 patients with diabetes and 300 non-diabetics. And the average age of menopause in diabetics patients with diabetes was about 44 versus 48 in non-diabetic patients, meaning that the diabetic patients were getting earlier, at least 4 years, getting their menopause 4 years sooner than non-diabetic patients. And when they looked at the patients altogether, all 600 women, more than 200, that is 212 patients, had early menopause, which is before their 45 years of age. Among all those 212 patients with early menopause, 54 were non-diabetic, and the rest, which were 158, were diabetic, meaning clearly showing the association that the more than three times incidence of early menopause in patients with diabetes. That means the risk is actually tripling. And in that present study, they confirmed that the type 2 diabetes increasing the risk of early menopause. Paying attention to their diagnosis of diabetes and proper management was warranted in those cases. And there was a European study, and the popular, we all know that this EPIC study, it's a huge, a large group of patients. They followed from 1992 to 2000s. European Prospective Investigation into Cancer and Nutrition, the EPIC for short. EPIC study was published back in 2015 in Journal Human Reproduction, titled Diabetes and Onset of Natural Menopause, the results from the EPIC study. So that was the title of the program. What they've done is they looked at a simple question. The question they were asking was, Do women have diabetes before menopause, have their menopause at an earlier age compared to women without diabetes? Pretty much the same question we're talking about right now. So more than quarter million women were examined or observed in this study, and the answer, the global and the final answer they came up with was that there was no overall association between diabetes and age at menopause, which might surprise to the audience. Now that we're talking about diabetes causing early menopause, but if you look at the details, sub details, what they noticed was something remarkable. The women with the diabetes who were diagnosed with the diabetes at the age of 20 years old had earlier menopause versus the women diagnosed with diabetes after their 50 years of age, who did not have this correlation. So the take-home message was the women diagnosed with the diabetes way earlier had a clear correlation versus the one diagnosed later would not. And then overall, there was no association, but there was a subsector that interpretation that we look into that, which is more supportive of our today's argument. There's one other study, again, published back in 2022, last year, in March of 2022, in the journal Frontiers of Endocrinology, titled Accelerated Ovarian Aging, meaning a rapid deterioration of ovarian function among type 2 diabetes patients and its association with adverse lipid profile. I include this study in today's discussion because what they have done is they examined these diabetic patients and looked at their age of menopause in terms of their lipid profile. So what they have done is they looked at these more than 900 of these type 2 diabetic patients versus 260 plus non-diabetic patient women between ages 18 and 80 or so. That's a wide age group, wide spectrum, the age bracket. They looked at the circulating sex hormones, to make the diagnosis of menopause, and their lipid profile, including your LDL, bad cholesterol, HDL, good cholesterol, triglycerides, and total cholesterol. And their conclusion was that the patients with the diabetes who have accelerated ovarian aging, meaning the rapid loss of ovarian function, was correlating with the poor lipid profile. So patients with diabetes had poor cholesterol or the lipid profile, had the worst outcome, resulting in early menopause. There's one last study I want to share today, which is again published by the Oxford University Press in the journal Human Reproduction back in 2015, titled "The Age at Menopause in Women with the Type 1 Diabetes," and the study's name was Ovadia. So in that Ovadia study, I included today's discussion because this is a little bit interesting about type 1 when you look at this correlation. So their question was, is type 1 diabetes a determinant of advanced ovarian aging resulting in early menopause? And they came up with this answer that after studying these 140 patients with type 1 diabetes and more than 5,000 women without type 1 diabetes, their final answer, the conclusion was there is no clear evidence if type 1 diabetes was resulting in early menopause. So this is something, contrary to what we were expecting in our typical type 2 diabetic patients. But overall, there's a growing body of evidence. And then it's still, I think, as you can see, the research studies are a little bit, scattered all over the place. But the predominant understanding as of today is that the earlier you're diagnosed with type 2 diabetes, the more chances you are to get early menopause before 45 years of age.